Welcome back, East Texas. We're joined now by Dr. Sinhan, Dr. Cacciatolo with CHRISTUS Trinity, Mother Francis. Thank you so much for joining us here today.
Thank you.
We're super excited to hear about this new technology you have going on, the Monarch robotic surgery technology. So tell me a little bit about that.
Yeah, fantastic. Well, first of all, thank you so much for having us today.
Yeah.
This is a very important topic, and a topic that's very near and dear to us, especially in Northeast Texas. People may not understand that lung cancer is actually the most common cancer in terms of death rates. And if you combine the death rates of breast cancer, prostate cancer, and colon cancer all together, the lung cancer death rate would still even be higher than the three of those combined. And the reason was because of the absence of a lung cancer screening program. Mm-hmm. So now we have lung cancer screening in Northeast Texas and throughout the country. And we're really working hard on that. Once we've screened the patient, then we find these nodules in the lungs, and we need excellent technology to go after these nodules. So now we have the Monarch robotic platform, which has really increased our ability to access these nodules in the lungs in a very minimally invasive way through a bronchoscope that goes through the chest and into the patient's body. And once we've shown visualization, we can actually biopsy this thing. We're very excited to have this technology.
Absolutely. So it kind of sounds like a game changer. Who would this procedure be for? Is it somebody kind of with very developed lung cancer or something like that, or maybe somebody earlier on in stages?
So another excellent question, and the whole paradigm here that we're trying to shift is to diagnose lung cancer as early as we possibly can. So these technologies are now used in people that have smaller and smaller nodules, almost a pea-sized to a walnut-sized nodule. We can go after much more accurately with the Monarch platform.
So is this available anywhere else in East Texas, or are you guys the only people performing this procedure?
This is available only at CHRISTUS Trinity, Mother of Francis here in East Texas currently, and there's only 20 or so of these in use throughout the country. So we're very excited to be one of the first programs in the country, and certainly the first in Texas.
So why is this, I guess, important to our East Texas audience, viewers at home? Do we have a big lung cancer problem here in East Texas?
Yeah, we certainly do. Obviously, everyone knows that smoking incidence is related to lung cancer. We have a very high smoking incidence here and a very high incidence of lung cancer. We see more cases here in East Texas than a lot of the even larger cities such as Dallas and Houston. Early diagnosis results in better chance at a cure, and this technology really allows us to find these tumors early and treat patients and improve their prognosis significantly.
If people at home want to learn more about this procedure, where can they find that and those details?
Yeah, of course, the details can be found on our website. We have links to the procedure and technology itself, and internet search as well. One can look for Monarch platform.
All right. Thank you so much for stopping by here today. We learned a lot.
Great. Thank you very much.
Thank you.
Coming